Many people check their blood pressure during the day, but few understand that the most critical period may actually be the early morning hours. Blood pressure naturally follows a daily rhythm. During sleep, it usually decreases. This phenomenon is called nocturnal dipping. In healthy individuals, blood pressure drops by 10 to 20% at night. However, shortly before waking, the body begins preparing for activity. Stress hormones such as cortisol and adrenaline increase. Heart rate rises. Blood vessels constrict slightly. This natural physiological activation causes blood pressure to increase. This is known as the morning surge in blood pressure. In healthy individuals, this rise is moderate and controlled. But in some people, especially those with hypertension or vascular disease, the morning surge can become excessive. Instead of a gentle rise, blood pressure spikes sharply within the first hours after waking. Why does this matter? Because the early morning period is one of the highest risk times for cardiovascular events. Research shows that heart attacks and strokes occur more frequently in the morning hours. The combination of increased blood pressure, thicker blood consistency after sleep, and sudden vascular stress creates a vulnerable window. When blood pressure is elevated immediately after waking, it places additional strain on arteries. Blood vessels that are already stiff or damaged become exposed to sudden pressure load. This increases the risk of plaque rupture in coronary or cerebral arteries. Morning hypertension may also indicate that blood pressure is not adequately controlled overnight. If medication effects wear off before morning, blood pressure may rise unchecked during early hours. Another important concept is non-dipping. Some individuals do not experience the normal nighttime drop in blood pressure. Instead, their pressure remains elevated throughout sleep. This pattern is associated with higher vascular risk. Understanding morning blood pressure patterns provides important insight into overall cardiovascular health. A single normal reading during the day does not always reflect what happens overnight or upon waking. Monitoring blood pressure consistently in the morning can reveal hidden risk patterns that otherwise go unnoticed. Morning high blood pressure is not just a number. It reflects complex interactions between the heart, blood vessels, nervous system, and hormonal regulation. During sleep, the body enters a recovery state. Blood pressure falls, heart rate slows, and vessels relax. This period allows the cardiovascular system to rest. However, in individuals with hypertension, diabetes, obesity, or vascular stiffness, this recovery phase may be incomplete. As morning approaches, cortisol levels naturally rise. Cortisol helps prepare the body for activity. It increases alertness, glucose availability, and vascular tone. In healthy systems, this response is balanced. In vulnerable systems, it may trigger excessive vasoconstriction. Blood viscosity also increases slightly in the morning due to relative dehydration and reduced movement during sleep. Thicker blood combined with higher pressure increases mechanical stress on vessel walls. In arteries affected by atherosclerosis, plaques may become unstable under sudden pressure changes. If a plaque ruptures, a clot can form. This mechanism explains why many strokes and heart attacks occur shortly after waking. Morning hypertension has also been linked to increased risk of kidney damage. Kidneys are highly sensitive to pressure fluctuations. Persistent morning spikes may accelerate microvascular injury. Another concern is masked hypertension. Some individuals show normal blood pressure during clinic visits but have elevated readings at home in the morning. Without proper monitoring, this risk may remain undetected. Sleep disorders such as obstructive sleep apnea also contribute. Repeated oxygen drops during sleep increase nighttime blood pressure and blunt the normal dipping pattern. These individuals often experience pronounced morning elevations. The key message is that timing matters. Blood pressure is dynamic. Understanding patterns over 24 hours is more informative than relying on isolated measurements. Morning hypertension should never be ignored, especially if readings consistently exceed recommended limits. To understand why morning hypertension becomes dangerous, we must examine what drives the excessive surge. The body's internal clock, known as the circadian rhythm, regulates blood pressure throughout the day and night. Hormones, nervous system signals, and vascular tone change in a coordinated pattern. But when this rhythm becomes disrupted, blood pressure control becomes unstable. One major factor is chronic hypertension. When arteries remain under pressure for years, their walls gradually become thicker and less flexible. This condition, known as arterial stiffness, reduces the ability of vessels to buffer sudden pressure changes. As a result, even normal hormonal activation in the morning may lead to exaggerated pressure spikes. Another contributor is overactivation of the sympathetic nervous system. Chronic stress, anxiety, poor sleep, and metabolic disorders keep the body in a state of heightened alertness. Instead of transitioning smoothly from sleep to wakefulness, the cardiovascular system reacts abruptly. Hormonal imbalance also plays a role. Excess cortisol production, common in chronic stress states, amplifies morning vascular constriction. Similarly, disturbances in the renin-angiotensin-aldosterone system increase sodium retention and vascular tone, pushing blood pressure higher during early hours. Salt intake is another underestimated factor. High sodium consumption leads to fluid retention. Overnight, when the body lies horizontally, fluid redistributes. In the morning, vascular volume may be higher, contributing to elevated readings. Obesity and insulin resistance further complicate regulation. These conditions promote inflammation, endothelial dysfunction, and sympathetic overactivity, all of which worsen morning surges. Medication timing can also be critical. Some blood pressure medications wear off overnight. If dosing schedules are not optimized, patients may wake up unprotected. Even environmental factors matter. Sudden waking due to alarm stress, immediate physical exertion after getting out of bed, or emotional tension early in the day may amplify the surge. Morning hypertension is rarely caused by a single factor. It is usually the result of accumulated vascular stress combined with impaired regulation. Identifying these contributing elements allows targeted intervention. One of the most serious consequences of uncontrolled morning blood pressure is increased stroke risk. Epidemiological data consistently show that strokes occur more frequently during the early morning hours. Why does this happen? First, cerebral arteries are sensitive to pressure fluctuations. When blood pressure rises sharply after waking, weakened vessel walls may not tolerate the sudden stress. If a small cerebral vessel ruptures, hemorrhagic stroke may occur. Second, in ischemic stroke, plaque instability plays a central role. Atherosclerotic plaques may rupture under pressure load. The body forms a clot at the rupture site, blocking blood flow to part of the brain. Morning blood pressure spikes increase shear stress on arterial walls. Shear stress is the mechanical force exerted by flowing blood against vessel lining. Excessive shear may trigger plaque disruption. Another factor is platelet activation. Platelets become more reactive in the morning. Combined with higher blood pressure and increased blood viscosity, clot formation becomes more likely. Individuals with diabetes, smoking history, or previous transient ischemic attacks are particularly vulnerable. In these patients, morning hypertension significantly increases vascular event probability. Silent vascular damage may also occur. Even without a major stroke, repeated pressure spikes can cause microvascular injury in the brain. Over time, this may contribute to cognitive decline. Monitoring and managing morning blood pressure therefore becomes not just about numbers, but about stroke prevention. Recognizing patterns early allows for preventive strategies such as adjusting medication timing, improving sleep quality, reducing salt intake, and managing stress. Just as stroke risk increases in the morning, heart attack incidence also peaks shortly after waking. The mechanisms overlap but involve coronary arteries supplying the heart muscle. Coronary arteries affected by atherosclerosis contain plaques that narrow blood flow. During the morning surge, sudden pressure elevation increases wall tension. If plaque rupture occurs, a clot may form rapidly, blocking the artery. Additionally, heart rate increases upon waking. Higher heart rate combined with higher blood pressure increases myocardial oxygen demand. If supply is limited by narrowed arteries, ischemia may develop. Morning sympathetic activation also increases electrical instability of the heart. In some individuals, this may contribute to arrhythmias alongside ischemic events. Patients with untreated or poorly controlled hypertension face significantly higher risk during this period. Those who discontinue medications or forget evening doses may wake up without adequate protection. Sleep apnea is another major contributor. Repeated oxygen deprivation episodes during sleep trigger blood pressure spikes and inflammation. These patients often have exaggerated morning readings and increased cardiovascular risk. It is important to emphasize that not every elevated morning reading signals imminent danger. However, consistent high values, especially above recommended limits, require evaluation. Heart health depends on smooth transitions between rest and activity. When vascular systems are stiff and reactive, this transition becomes risky. Understanding the connection between morning hypertension and heart attacks reinforces the importance of 24-hour blood pressure control rather than isolated daytime readings. If morning blood pressure is consistently elevated, the most important step is structured monitoring. Measuring blood pressure immediately after waking, before coffee or medication, gives the most accurate picture of the morning surge. Keeping a daily log for 1 to 2 weeks helps identify patterns. Numbers matter, but trends matter more. Repeated readings above recommended limits should not be ignored. Medication timing is often crucial. Some patients benefit from evening dosing of antihypertensive medications to ensure coverage during early morning hours. This decision must always be made with a physician. Reducing salt intake can significantly lower morning readings. Excess sodium increases fluid retention, which contributes to elevated pressure upon waking. Improving sleep quality is another key strategy. Poor sleep and sleep apnea blunt normal nighttime dipping and worsen morning spikes. Addressing snoring, weight management, and sleep hygiene may reduce risk. Hydration also plays a role. Mild dehydration overnight increases blood viscosity. Drinking water after waking may support circulation. Stress control is equally important. Gentle morning routines, slow rising from bed, and avoiding immediate emotional stress help reduce sudden cardiovascular load. Regular physical activity improves vascular flexibility. Flexible arteries absorb pressure changes more smoothly, reducing morning surge intensity. The goal is stability, not perfection. Gradual improvements in lifestyle and medical management significantly reduce long-term vascular risk. High blood pressure in the morning should not create panic, but it should create awareness. The body follows biological rhythms. Some variation is normal. What becomes dangerous is persistent elevation combined with vascular damage and lack of control. Morning hypertension is often the first visible sign that blood vessels are under stress. It may reflect arterial stiffness, hormonal imbalance, chronic inflammation, or untreated hypertension. The encouraging message is this: vascular risk can be reduced. Blood vessels respond to change. With proper medication, lifestyle adjustments, improved sleep, balanced nutrition, and stress reduction, the morning surge can be controlled. Ignoring patterns allows silent damage to accumulate. Monitoring patterns allows prevention. Your cardiovascular system works every second of your life. Supporting it means paying attention not only to how you feel during the day, but also to what happens when you wake up. Morning pressure is not a verdict. It is information. And information allows protection. Take it seriously. Act early. Protect your vessels. Protect your life. If your blood pressure is highest in the morning, your body is not whispering. It is warning you. Most strokes and heart attacks do not happen randomly. They happen when silent risk builds up, especially in those first hours after waking. The number you see on the screen is not just a measurement. It is a reflection of how your vessels are aging, how your heart is coping, and how your lifestyle is shaping your future. Do not wait for symptoms. Do not wait for fear. Monitor it. Control it. Act before damage becomes irreversible. Because the most dangerous blood pressure is the one you ignore. Your morning reading could be the difference between prevention and emergency. Choose prevention.